All right, my name is John Ruddy, and I want to give you a little dental 101. I know that when I got into dentistry, I had heard all of these words from all of these people, and I had no idea what they were. And so I want to give you a little bit of insight, shed some light on what is it that we're talking about in a dental office. So here we go. We're off to the races here. There's two different sets, or not sets, but areas of dentistry that you are dealing with on a daily basis. And that's what we're talking about in most cases. So you either have the preventative side, which is just like it sounds. We're trying to prevent something happening to someone's tooth or teeth or gums. And then you have the restorative side, which is actually fixing anything that is wrong. And so I want to talk about who's doing the work and then what kind of work are we doing? All right. So first and foremost, let's talk about preventative. Typically, your hygienist is going to be the one that's going to do the restorative work, and it's when you call up for a cleaning, that's kind of what you're asking for is preventative work. So most people don't really have a high dental IQ. So when they call the office, they're going to usually ask either for to see the dentist because they're in pain or something's broken, or they just want to get a cleaning, right? And so let's talk about the different types of cleanings because if you are a normal, healthy adult, okay, and I'll go over what that looks like here in a second, then you would get a regular cleaning every 6 months. And so if you're looking at your reports, you might see, or on the computer screen, you might see D1110 or D1120. That is an adult prophy or a child prophy, respectively. And like I said, you can schedule these every 6 months. And because of the waiting periods with dental insurance, you may see it 6 months and 2 weeks, just so that they don't accidentally come in too early for their cleaning and not be able to have their benefits paid by the insurance. But the ones, twos, and threes at the bottom there, they're an indication of probing depth. So a hygienist will take a perio probe, and they will probe three sites on the front and three sites on the back of each tooth. And what they're looking for is the separation between the gum and the tooth. And so if it's less than 3 millimeters, then they have healthy gums, healthy bone structure beneath the gums, and their tooth is in a good spot so that they could have a regular cleaning. Okay. And so when they do these probes, and they usually do this in a initial exam, sometimes they'll find fours, fives, sixes. The numbers go up and up. But if there are enough of these numbers in a row, then they likely need a deeper cleaning, at least in that quadrant, possibly the entire mouth. That's what, when you look up here, the SRP, what this is basically saying is that we're going to do an SRP one time, okay, scaling and root planing. And then after that, we'll talk about what happens next. But that's where you see these D43, 41s, 42s, and 46s. Essentially what we're trying to do here is we're trying to clean out the infection. It means there's an infection in the gums that needs to be addressed. And so when we clean out that infection, these numbers should get lower. They probably won't all go back to ones, twos, and threes, but we want to keep them as low as possible. And so if we do the deep cleaning, then we'll be able to put them on a regular maintenance after that. And then, of course, they'll be able to come into the office for, the next, every 3 to 4 months. Okay. So instead of 6 month cleanings, they're going to be in the office every 3 to 4 months as prescribed by the hygienist and the doctor. You'll see also, when you go to look at the numbers, the fours, fives, and sixes, it's an indication not only of the infection, but there's likely to be some bone loss. And so when you get the x-ray, then you can see and verify, okay, not only do I have the numbers, but with the x-rays, I can tell that this person needs a deeper cleaning, okay? And so perio maintenance. Now, when you come in for your regular cleaning, it's gonna cost, somewhere in the neighborhood of $100, you give or take. But the scaling and root planing is going to be quite a bit more expensive, probably about $300 per quad or more. And then, of course, the perio maintenance is going to be quite a bit more expensive than a cleaning. But the whole point of doing any of this work is so that they don't need more work over time, all right? And when I say quite a bit more, I'd say 150, 170. I'm just kind of shooting from the hip here. Depending on your area, it could be different. The point is here, though, we want to make sure that we do this. Why? Well, one of the worst things that can happen in your mouth is you actually lose a tooth. And what we know about periodontal disease is that when the gums and the bone structure in your mouth are deteriorating, then that is a kind of a ripe playground for losing teeth, even healthy teeth coming out of your mouth. And then the fix for that, of course, is way more expensive and sometimes not possible depending on the bone structure in your mouth. So when we're talking to people about the importance of why they would go from a regular cleaning to do an SRP and then go into perio maintenance, well, the importance of doing that is so that we can keep healthy teeth healthy in their mouth long term. All right. So every about once a year, you'll do an X-ray and a exam with, or not a X-ray, many X-rays and exam with your hygienist or your dental assistant, and the doctor will take a look at those and just kind of diagnose anything that's going on in the mouth, and just make sure that everything is progressing in a good manner. Okay, what I mean by that is that there's no decay that's actually progressing in a horrible manner. Because here's the thing. Decay doesn't just go away on its own typically, or teeth they don't heal themselves on their own. Sometimes you have active decay and sometimes it's not. But the point is that your tooth is not going to regrow its structure. It's not going to reform itself after it's compromised. So that's why we have the restorative work that we do. Okay, so if preventative work is all of the cleanings and the maintenance of the gums and just kind of keeping an eye on the bone structure in your mouth, then the restorative work is actually the fixes for the things that are going wrong. So, this is where you get into your fillings, your crowns, your root canals, and that kind of thing. So, let's talk a little bit about what a filling is. And, some of this may be intuitive, maybe something that offhand, but let's just kind of talk a little bit about kind of the nuts and bolts here. All right. So, fillings is kind of what it sounds. There's some compromised areas in the tooth. And really, there's 1 to 3 surfaces of the tooth that are compromised. Now, you have 5 surfaces of a tooth. Okay, when you look at your schedule, it might say MOD or OD, MODL. Those are all surfaces that are being filled on your schedule there. Okay, and so there won't typically you'll see up to 3. If you see 4, that's usually an indication you need to do a crown and a conversation that someone will have with the doctor. But typically what happens is the doctor will go in and they will remove all the decay. All right. And so they'll remove all the decay, they'll make sure that everything is nice and clean in there, and then they will fill in the spots that they removed with a composite material a lot of times, or some sort of tooth looking material these days. But over the years, you might see people that come in, they have amalgam fillings. That's a silver filling usually. Typically, they're in the back of your mouth because people don't want to walk around with silver in the front of their teeth. But your office will let you know what's the most common, either resin, composite, whatever material that you're using these days. Okay. The next thing is okay, if the decay is compromising more than 4 surfaces of the tooth, or it's just a large portion of the tooth that just can't be fixed, or a filling can't fit on there, then we'll have to do what as a crown. You might also hear the word cap or something like that. Okay, and so. So what this means is that the doctor will actually remove all the decay like he did before, and he will prep for the crown. Now, in most cases, your office is doing a 2-step process for your crown. They come in for the prep date, and then they come back a few weeks later for the seat date after they get the crown back from the lab. In some cases, you have a milling machine in your office, and it's making the crown in the office on the day that they are actually getting the prep date. And so, depending on your office will let you know. But the point is that it's kind of a 2-step process. You do the prep first, okay? And this is kind of what the prep looks like. It's not exact, but basically they're making a portion of the tooth that you can put the crown on top of and cement long term, okay? And so in some cases they need to do a buildup on the crown, and so that can add a little bit of cost to the crown. In most cases, your crowns are going to cost in the neighborhood of 1,000 or more. In most cases, it's going to be more. If you have a buildup, it's going to add a couple $100. Your fillings, they're going to be in the hundreds of dollars usually. And so we want to try to have people do the work when they need a filling. Okay, because if we can have them do the work when they need a filling, we can save them hundreds of dollars, in some case thousands of dollars. All right. What I like to tell people is that your teeth are never getting better, and the fix is never getting less expensive than it is today. So when somebody, has treatment, they look at all these fillings that they need to get done. Really, we're going to save them thousands of dollars if they come in and get the fillings done. Okay. So, in the case that the person needs a crown, they come in, they get their tooth prepped. Sometimes they have that build up there, and then the crown that's put on there looks exactly like the tooth, or as most exact as we can make it. And the shade is matched from the old tooth and that kind of thing. So really, when a person leaves, so the question that I get a lot of times is the crown permanent? And the answer is yes, it should be permanent. Okay. You know, God bless. Sometimes people walk out and their crown does fall off, but in most cases that's not going to happen in your office. But the crown is permanent. It's in the mouth. It's not removable or anything like that. So this is one of the best fixes that we have for a tooth that's compromised, and a really good way to have this tooth repaired before it gets too late. Okay, so the next thing is that, well, what about a root canal? What is that? Okay, and of course I put a frowny face on your root canal here, because in most cases, if you need a root canal, you're in pain. Now, what we want to tell people is that the actual procedure, the root canal, because it kind of gets a bad rap sometimes, because people are like, oh no, I don't want to have that because it hurts. Well, the root canal actually is the fix for the hurt. It actually helps you to feel better. And so basically, what this means is that the decay has gotten into the nerve, okay, and it's compromised the nerve, and that's why it hurts, okay. And so here's the thing: we can't just do a root canal and then keep the original tooth, because we're going to have to drill all the way through that tooth, and we don't tell our patients this because we don't say the word drill. But basically, we've got to get to the nerve, and we've got to remove the nerve from the tooth. So as a part of the process of the root canal, which can cost in the thousands of dollars, we also have to put a crown on that tooth as well. All right. So what they do is they take the nerve out, they fill in the canals where the nerve was, and then they will eventually put a crown on that. So sometimes this could be a process. Sometimes they'll do the root canal and they'll do a large filling to just kind of cover up all the work there, and then they'll come back for the crown prep, and again for the crown. So again, it's the longer we wait to do something, the longer the process, the more expensive it gets, the more pain that can be associated with the procedure and that sort of thing. So the root canal is the fix for any hurting tooth, or any tooth that's compromised and has the decay is in the nerve there, okay, or infection is in the nerve. All right, so the next thing is a bridge, okay? So our bridge, basically, it's just like it sounds, just like a bridge has two sides, and it kind of goes over some sort of missing spot, okay? That's exactly what a bridge is, because basically, if three or more teeth are compromised, okay, then what you'll want to do is you want to make sure that you fix all three teeth, and what it will look like is that they will make two posts on either side. So you'll see that tooth in the middle will actually be taken out completely. Okay, so that will be extracted, and the teeth on the either side will have they will make like a post there. And then when you put the bridge on, it looks like your real teeth again. Okay, so again, this is a permanent solution. This is not something that you take out. Sometimes you hear when you're talking about something that's taken out, a lot of times a partial comes out. This is not that. This looks like your teeth. It performs like your teeth, and it's going to help. So that, here's a few reasons. Number one, if you're in a situation where you need a tooth to be extracted, you're going to want to put something. You're going to want to fix that as soon as possible. Why? Because your teeth in your mouth, they all push on each other, and they're pushing to the center here. And so when you have a hole or a gap in your teeth, your teeth are still pushing. And just like if you were to push over like on a tree that was next to a ravine or something like that, or some sort of like creek bed or something like that, eventually you could get that tree to fall over. So you can lose healthy teeth if you don't have something to replace that. And that's why a bridge or some sort of replacement is the best option for somebody long term. Okay, so the bridge again looks and performs like healthy teeth. Now, what happens if it's just the one tooth? Okay, if the one tooth in the middle needs to be replaced, then doing a bridge on two healthy teeth, so let's just say the two outer teeth are perfectly healthy, they don't have any problems, they don't need crowns. Well, it wouldn't make sense to really compromise those two teeth. Okay, the best teeth in your mouth are the ones that have never been compromised, and so for a dentist to go in and then put a bridge on, over some really healthy teeth, doesn't make sense. So that's why an implant is a really good option these days. Okay, it usually is way more expensive than a crown, but I say way more. It's probably about 4,000 ish dollars. Okay, but if you think, the bridge is about $3,000. Okay, and in a lot of cases, a lot of the dentists are making it competitive enough that it's actually about the same price as a 3-unit bridge. All right, but the point is that the implant, instead of compromising the teeth on either side here, they're going to remove that tooth. They're going to extract that tooth. All right, first thing and first foremost, and then they're going to place the implant in there. And basically, what they're going to do is they're going to put a little, it looks like a little screw, okay, that they put in the gums there, and they fuse it to, or they put it inside the bone structure there, and then that's going to have to heal for some time. Okay, so they're gonna walk out with something that kind of looks like their teeth and that kind of stuff, but they have to let that heal a good amount of time. It's going to take months before they actually put the implant crown on there. But in terms of a long-term fix, implants are really top notch. I mean, they're performing way better than even crowns, because the way that they're made. Okay, so really an implant. So if a person needs implants, you can tell them, you know what, actually, this is the best fix for your teeth, because these are going to last longer. Okay, usually a crown will last anywhere around 5 years or more. It kind of depends on the crown, where it is, how often you use it, and chomp down on it. But typically they're going to need to be replaced over time. Okay, and same thing with maybe you're in need of dentures. A denture is good for a while, but it's going to be need to be replaced over time. And so that's kind of the short course on dentistry. I hope this answers a lot of questions for you. Hopefully you learned a little bit about some of the codes and the importance of why we recommend what we recommend. But by and large, these are the procedures that you're going to do in your office, and this should give you a good start for where you're going on the road. My name is John Ruddy. I'm That Dentist Guy. I hope this helps. It would be my honor to partner with you. Go to thatdentistguy.com and you can see more about how you can partner with me to make your office the premier office. Get an appointment there, and we can set up just a 30-minute free consultation, and I can tell you all about it. I hope you're well, and we'll see you next time.